We're going to talk about something new and innovative around a pediatrician's vision to care for families and provide an adjunct to the medical home for children's health care in a way that I don't think's been done, in a way that brings telehealth and education into one trusted brand, one platform, one membership model.
Hey, what's up, guys? Spencer Smith here, host of the Self-Funded with Spencer podcast, sponsored by Pareto Health, ClaimDoc, and PlanSite. Enjoy today's episode. Yeah, I would say just on a personal philosophical level, I think it's one of the best, in terms of things that I know definitely work. Yep. Again, let's go to tangible ROI, check. But it's also the quality of outcomes for literally everybody involved in the transaction.
It is high value for everybody, and it's just a different way to spend dollars that are going to spaces that doesn't get the same value. Yeah. Oh, and then everybody feels good about it too.
Oh, and it doesn't have to go through insurance as well.
Right? Well, I am so... and I love, watching some of your all stuff and the people you're around and wanting to be disruptive when it comes to insurance payments. Mm-hmm. I am so growing in my space the antithesis of corporate healthcare and insurance payments when it comes to delivering healthcare, and being very sensitive to those who actually are paying for healthcare costs. It's the employer. Yep. Period. And the end consumers should be really the physician, taking care of the physicians who take care of the patient and take care of the patients and the employees. So, yeah, we're
aligned there for sure.
Oh, dude, right. That's why moving this conversation forward, whatever makes sense for your all's world and mine, that's my mindset where I'm going the rest of my career.
I love it, man. Well, it's a great way to kick off the podcast. I assume we're ready to go, right, Nathaniel? All right. So I'm here with Josh. It's Honaker, right? Is how you say it? Okay, I want to get it right. Josh Honaker, who is the CEO of ParentMD. How you doing, Josh?
Fine. Thanks for having me.
Well, good to have you down from Louisville, Kentucky.
Louisville.
Right? Oh, yeah, man. So Louisville. I don't know the right way. I'm in Texas, and I'm not sure if our accents
say it a lot of different
align properly. But I appreciate you coming down. Very excited to talk about this. Haven't covered anything like this, and I think it was Scott who planted the seed in my mind at U-Powered Symposium in Miami about a year or so ago. Yep. And we've been trying to get this booked ever since. So glad we're finally here and get to do it, man. So welcome, Josh.
Oh, glad to be here. Appreciate the invitation.
My pleasure. So let's get to know you first before we go into what ParentMD is. But will you at least plant the seed of what we're about to talk about for the first hour before we go into your bio?
Sure. We're going to talk about something new and innovative around a pediatrician's vision.
Boom. We're going to make that a clip, Nathan, right there. That was just perfectly done, Josh. Well, I presume you've told the story many a times, but that was very good. So let's get to know you first, man. I've had an opportunity to get to know you over the last hour or so for coffee, but want to give the audience a chance to do the same. So tell us a little bit of your backstory, man.
Yeah. Well, I always kind of start, I'm a pediatrician by trade. That's my identity. So I'm from South Central Kentucky in Bowling Green, home of the Corvette, right down the road from Mammoth Cave, longest cave system in the world. So grew up inside of Bowling Green, but just outside in a little bit of rural Kentucky and a farming community. And so grew up there, went to Western for undergrad, where I met my wife. So Hilltoppers, Big Red, if you don't know what the Big Red mascot is, you'll have to look it up.
Okay.
Went there for pre-med, did biology and chemistry as my undergrad focus majors, and then went to University of Louisville School of Medicine in 1994. Did medical school there, decided to go into pediatrics, did my pediatric training at Coastal Children's Hospital then from 98 to 2001. And at the end of my training, I had to decide what I was going to do and decide to go into pediatrics, general pediatrics.
I was going to ask you that quite. Yep. I think we talked about it over coffee, but might as well address it again.
Sure.
When it comes down to selecting a specialty as a physician or in med school, how do you go about finding out pediatrics was your thing?
Yeah. Well, I think a lot of physicians happen to find their thing and some don't.
Okay.
And some change and pivot. And I think there's a lot of variables, but for me, it was probably a story similar to many doctors that you go into spaces based on your mentors, things that fit your personality, the personality type of the doctors. There's a surgeon mentality, there's a pediatrician mentality, there's a primary care, there's a hospital. There's different mentalities of how you practice your bedside manner. Kids fit well with me. I had a phenomenal first mentor, Dr. Denise Bratcher. I just loved her approach, and I was like, I want to be like her. That's the kind of doctor I want to be like. So I'd say mentor was big. Also, pediatrics tended to fit me. I'm very much about the family. I like kids. And my wife and I just had our firstborn when I was right around the time of my first pediatric rotation. He's 26 now.
Yeah.
So 26 years ago. So that was the time. And then the next year I vetted by taking some pediatric rotations and said, yeah, this is my thing. These are my people.
Well, as I say, it's probably one of those specialties, and I think most physicians get into that career path, or I suspect because they want to help people, right? That's kind of that overarching mission.
Right.
But then when you apply that down to the level of children, right, and taking care of kids early on, obviously, that as they're developing and all those things, I mean, I don't think it would be difficult to get up in the morning and feel like you're doing good in the world. Now, what was reality like, though? Like, obviously, when you went out, I think you said you were in private practice for the first 8 years of your career. So tell me a bit about that.
Yeah. So I interviewed a number of great places during residency, as we all do, trying to decide what to do after our pediatric training. I decided I wanted to start my own practice. I come from a very entrepreneurial family, so I spent my last year and a half of training deciding where and how to set up. So I found a property, set it up with a partner, and graduated July 1, August 15th. We opened the doors, 0 patients.
Okay.
It was Oldham County Pediatrics. 8 years later, we had 9 doctors full. So it was a success story. I think one of the still premier practices in the city. While I was there, I did a number of leadership roles, just got tapped on the shoulder, to be honest. I wasn't looking to ever leave private practice and not see patients every day, but I was invited to be the chief medical officer of the local hospital 1 day a week. I was invited to be the assistant residency program director back at the medical school for training of young residents. And they had me oversee the business side of medicine, private practice, and child advocacy, because I was also the president of the state pediatric society at that time. So I had these other administrative, education, and leadership roles that I got pulled into. And then,
did you like the academic side?
Oh, yeah, I loved it. I loved the concept of training the next generation, impacting pediatricians on a different level. Had a lot of residents and students with me in my office. So that's where I got my passion. Then I was invited to be the chief of general pediatrics at the medical school, 8 years in private practice. So I left what I didn't think I would ever leave, because I was totally happy and fulfilled. But I felt there's a higher calling to go lead on a different level. So I had about 60 general pediatricians in that division for 2 years, and did that role. And then Norton Healthcare, which also had the Children's Hospital. I just finished being president of the medical staff of the Children's Hospital. And in that interaction, they were in a place of looking for a physician executive to oversee their burgeoning medical group of about 400 providers at Norton Healthcare in Louisville, which took care of about half the city of Louisville. It's a pretty big group.
What did you like being able to influence at that scale, right? Because it's different than a one-to-one patient interaction or with a family, right? So it's a different role, but maybe a broader base level of influence. So did you enjoy that?
Yeah. I think for physicians, your identity, and you come in learning one patient at a time with the bedside manner, and that's how you practice medicine. And you really don't know anything else than that. Short of today, doctors learn a lot about a lot of different roles. That was all I knew. So then to start looking at the world through a different lens, that maybe I could impact more people on a population health or by leadership or policy or advocacy or education. Those are all kind of new to me, and they came about by accident. But yeah, that really intrigued me. I love the concept of, just from efficiency and economies of scale, doing a few things that can impact a lot of patients, a lot of doctors. That was very fulfilling. But I missed not seeing one patient at a time. And so I only had 8 years at the bedside, and short of when I was in med school, 2 days a week I saw patients with med students and residents, but I was quickly getting pulled in the other direction. Then when I came to Norton Healthcare as the VP medical director of the medical group, I stopped seeing patients because my boss in Norton Healthcare said, we've got too much here for you as an executive to do. So I got my MBA while I was there, and then I was there for 10 years.
Well, I was going to say, I can relate at least to what you're describing now. I think I shared this with you over coffee as well. You know, in my current role, I'm not selling one-to-one to consultants anymore. And so that's a new experience for me, whereas perhaps my role at this point, and something my colleague Sean Wood refers to as the one-to-many conversation. So rather than having those one-on-ones, my job is to have the one-to-many in group settings and influence through conversations like this. So part of me misses a little bit of that, hey, go and make a sale. The other part of me goes, hey, maybe that's not your role anymore. And so embrace this new idea of leadership and these broad-based conversations that I'm I'm having rather than the one-to-one. So just connecting with you with that when you went through that phase of your career. So how long were you doing that? And I know there's a couple, you are an entrepreneur, so I know you stood up a couple things in between then, but tell me about transitioning sort of out of that leadership and that CMO role and et cetera.
So when I came to Norton Healthcare, again, when we started, it was about 400 providers in the medical group. And my role progressed to be the chief medical administrative officer. And by the time I left there 2.5 years ago, my role I was over about 1,700 providers, mostly doctors and a number of APPs. So overall things, clinical quality, compliance, compensation, contracting, physician leadership development, a medley of a lot of roles that fit me well because I like a lot of different things. And so got to be a part of that growth and development. And then over my last couple of years, I had a real itch, though, getting ready to turn 50. And I've embraced change through my career. Obviously, you can learn that from my story. I had the itch to be on my own again, to be a serial entrepreneur, to grow a couple new businesses we'll talk about. But I just had a desire to have a little more freedom and flexibility outside of the corporate world. But I cannot emphasize enough where I was at. It was as good as it gets in the corporate world. Norton Healthcare is phenomenal from a brand, mission, patient-centric, physician supportive and friendly. And I had a lot of resources and a lot of flexibility to do things there. I just had an itch to do more in the last phase of my career.
I mean, I totally get it, right? And you have these, we were talking about influencers earlier. You have these folks that really sort of showcase how amazing being an entrepreneur is and suggest that everybody should be an entrepreneur. When the reality is it takes a very rare breed to truly be an entrepreneur. And a lot of people can thrive within the framework of working for somebody else or be an intrapreneur inside of an organization. But I get the itch, right? I totally understand. And so you felt, I've got to scratch this itch completely, right? What was it about, you mentioned freedom, but was it the variability of what you do? Like, what was it that really attracted you to be an entrepreneur fully? Pareto Health is the manager of the largest employee benefits group captive in the United States. And it's also now the main sponsor of the Self-Funded with Spencer podcast. I chose to partner with Pareto Health for 3 main reasons. Number 1, their dedication to improving the world of health benefits. Number 2, their mission to reduce volatility and to make self-funding simple for mid-sized employers. And number 3, the strength and scale of their program. With over 2,300 member groups and more than $1 billion of stop-loss premium under management, Pareto Health is the most robust solution of its kind in the country, period. Stay tuned for more information because I'm sure I'll be featuring them on an episode of the podcast very soon. Visit Pareto Health at ParetoHealth.com or follow them on LinkedIn to stay up to date on the latest news and developments.
I like the word variability used. I think we were talking earlier. I love my days being different. I love working on might be working on a real estate venture in healthcare this hour. Next one thinking about technology. This one thinking about partnering with brokers and insurance and self-insured employers on how to bring value to them in different ways. Or just hearing other doctors' ideas in the entrepreneur world. So the corporate setting of the healthcare, your task there was to be a fiscal healthcare executive steward around the resources they had to improve the care of the community. I loved it. A lot of variability, a lot of resources. But I knew being on my own, I could kind of create my own agenda, be a part of an owner of different entities, be a fractional physician executive leader for a number of entities, do consulting, and bring all my experiences as an MD, MBA with that background and bring value, but also own a few pieces of companies and start some other companies, which just excited me to put all my energy into. I love growing things. And honestly, I was kind of getting probably a selfish part of my career. I want to grow some of my own things, my own
totally
ideas.
Get that. Well, and do you like the early stage development too? Because some entrepreneurs will want to buy businesses that already exist and grow, and some of them want to start them, right? But then some of them also go, I started them, I got them here, and now I'm out. I want to go do something new again. So where do you fit in that spectrum of entrepreneur, you think?
Yeah, that's a great question. I maybe never even thought about in the way you just phrased it. I would guess I'm most energized in the early brainstorming startup phase, even though that could be the hardest lift, the most frustrating. You go past the excitement, the honeymoon phase, and then just get there and do the work. But if I have a vision of where I want to go and I got the right people, resources, business plan, and it's a good concept, that energizes me, and I'll go through that wall or climb that mountain. And then to see the fruits of the labor and things start to come together when it's so hard and you could easily stop and fail many times, I kind of thrive on that.
Yeah.
It's like causing pain when others are like, why would I choose that pain? But I love seeing the results of growth and development.
That is growth, right?
Yeah,
you
I
said
love
it.
that.
Yeah, the growth. Well, so I know we're going to spend most of our time in the rest of the middle, at least here on ParentMD, but you do have this other business, Honaker Health, that I think you stood up first, correct? Or
I
they
stood it up in
simultaneous?
parallel.
Okay.
Yeah.
So what does Honaker Health do, though? I want to give you some time to talk about that.
Well, I knew I needed a brand for myself. Obviously, Honaker, the surname, my last name.
It rings well, too, Honaker Health. I like that, man.
It goes well, and I think we got a pretty cool logo with it, too. But it was really... the vision was just to have a brand in a place as I owned pieces and parts of companies or started companies or did consulting or provided fractional medical executive leadership roles, that it would come under that entity, and that was kind of the brand. So that's been an evolving, growing activity. So have some leadership roles, have some consulting roles, have some ownership in some different entities. Kind of been everything I want it to be, so it's really early in the process.
Well, I mean, we were I guess, discussing this earlier, too, the topic of capacity, right?
Yeah.
Every human being has a certain amount of capacity, no matter how efficient and hardworking you are. So are you sort of testing the waters to see what your capacity may be? Are you trying to find the breaking point, possibly?
I would say yes and yes and yes. And I will go and highlight that my best coaches are my two sons who are 26, 23, and my wife of 30 years. They know my limits. They know I often push it, and often I spin a lot of plates but drop a few plates. So I'd like to think through the years of maturity and wisdom, I'm learning how to prioritize better, optimize my time, focus. But as we talked about earlier, probably the biggest things I've learned is I can spin a lot of plates, but I can only do is I have a lot of the right people around me.
Yep.
So I do know and realized from the book Traction years ago that I'm really a CEO, visionary mindset kind of person. If you can have me in that space, I can do quite well with a lot. But if I don't have the right ops and resources and people around me, I start dropping plates and I don't do as well, and I'll often take on too many things. So that's been a bit of growth for me the last 3 years, is knowing where to prioritize. ParentMD is my baby. That's the number one. And then everything else I do is along the way as I stand up ParentMD in parallel, so create revenue for my family to live on in this entrepreneurial space. But I've definitely had to learn how to balance and prioritize, and I often have taken on too many things, but I think definitely last year has been about learning to focus and prioritize, because if you can't get traction, you can't stand things up and do things well, you're wasting your time and wasting other people. So it's been a learning.
Leverage of your leverage over your time, right? So
really
you do a good job of sort of finding the people to operationalize the business, so you're not kind of the bottleneck,
exactly.
which I think some entrepreneurs will want to create businesses where solely sort of about them and they're the most important thing in that organization, and that limits the ceiling of what can be accomplished if you want to be that bottleneck. It sounds like you don't have that desire necessarily, and you're willing to surround yourself with great people.
I'm actually energized by not just growth and development, but actually by growing teams, getting right people around me, and leveraging my time and leadership to support them. Actually, that's what energizes me. So, but I don't go into ventures unless I know I got the right teams and resources and people, because I know I won't likely be as successful. I'm not the person who wants to do every piece of it and own it. I know I'm not the best, and so I try to stay in my lane where I can do it best.
Right on. Well, so let's ease in now to ParentMD and talk about that business, because I know you said that's your baby, but every baby has an origin story, if you will. So I realize it's probably a few years back where this concept, at least in your mind, started to evolve. So what was it like? What was the recognition, if you will, of this need that ended up becoming ParentMD?
I think I always saw the need, the gap, and the opportunity back when I was in private practice, but didn't know what the solution was or how I might play a bigger role until years later. But in my corporate world, where I was supporting a lot of physicians, and we had hundreds of pediatricians, generalists, and subspecialists at Norton Healthcare, I saw a common frustration with them and the parents. So despite how great a physician might be and how great parents might be, there's often a disconnect as far as access when it's needed, time with the patient, and everybody left feeling frustrated. The physicians often are making widgets. I hate to say it that way, but it's the truth of the matter. Physicians are limited time slots and cranking patients to make a certain paycheck, and for the corporate world, they're having to do volume. By the very nature of doing volume on a limited time schedule and a limited number of slots, the parents only get access a certain amount of time, and then it's harder to get in. Parents always have more questions. The children's healthcare issues are usually more complex. Oh, and today mental behavioral health has become a big issue. And that takes time. You can't just fix that with a pill. So all these things require time. Time is the limiting variable. So I felt like education and telehealth were two things that were needed more. And I was seeing parents, the other trend, obviously you know this, as a father of two young ones, you and your wife, parents were going more and more the last year to the internet and looking and searching, trying to find trusted quality information, trusted quality telehealth partners. So I thought as a pediatrician business person, there might be an opportunity to create a brand, ParentMD, that could be the one-stop shop membership model to bring telehealth partners that I've vetted and contracted and partnered with. Have a couple studios of my own where we create content. I bring experts from around the country and work with fellow pediatricians what they think parents need to know more of. And we bring that all in one platform, one membership model, one-stop shop, trusted, and parents can get it, have a peace of mind, and improve access and be an adjunct, be a partner with the medical home. So this isn't to circumvent the medical home. This is very much to be an extension, to be a partnership. And there's a slide I often show in my deck when I give an overview of ParentMD. I believe holistic care today has to be a partnership of the medical home plus the virtual world. Well, one of our taglines is that we want to be your virtual children's healthcare partner. So you got the medical home and you got ParentMD. Then I think you've got holistic care. So that's it in a nutshell.
Well, and so let's talk about, because I know early on the focus was on direct to consumer, and that sort of evolved to look at the employer chassis as well. But let's just talk about the brass tacks experience. If I'm a mom or a dad that downloads it's ParentMD's an app, right? Or is it
it's
all
a web-based
platform?
Okay,
so
we
it's
are
web-based.
working on an app as we talk to do our due diligence of how to proceed.
Okay, so web-based today. I log in. What are the things that I'm going to this your site for? What am I hoping to get? What's the experience like? Walk me through that.
Yeah, great point. When you come to ParentMD.com, I always say that we've got three legs to our stool. And it took me a while to identify what it is we're bringing and what it is. And it's funny how everything falls in groups of three. You know, the very first is telehealth, and then we'll talk about that more in detail. Second is education. Third is community. So I hadn't seen where a pediatrician partner with parents had brought all these together in one trusted place. So telehealth, we have three telehealth partners. One is Blueberry Pediatrics, renowned around the country for having great 24/7 board-certified pediatricians, easy access, great care. Oh, and they provide you a digital toolkit. So they give you a digital otoscope. They give you a thermometer and a pulse oximeter. So just to help expedite that.
So they mail it to you, or how does that?
They mail it to you. So you become a premium member with ParentMD and you sign up for Blueberry Pediatrics. They'll mail you this kit, which is normally $100, but with the premium membership, you get it free. Some of the best stories that we've had, Spencer, are parents that say, hey, the common scenario, you've already been through it with your kids, I'm sure, with ear infections. You're 10 o'clock, high fever, ear pain. Parents are busy going to work the next day. What do? Now you know you're going to have to set up an appointment to look at that kid's ear, and probably needs antibiotics, but you don't know for sure. And you need to make sure there's nothing else going on, okay? Fever and child in pain. You assume it's an ear infection, but you always worry, is it throat, strep, or is it something else? So when you can have Blueberry and get on there in 10, 15 minutes and you get a video of the ear and you see a pus pocket behind the eardrum, and they get to look at the child, take the history, and talk to you, and like, wow, that is a purulent otitis media, needs an antibiotic. Oh, we can call in the script for you right now. Bam, diagnose the problem, solve the problem. Parents can go to bed with peace of mind and go into work the next day knowing how to manage that problem. So that's a classic anecdote and story we tell time and time again. But one thing we learn in medical school is with clinical diagnosis, if you can take a history from somebody, you can nail the diagnosis 80% of the time. If you can look at and or touch the patient, 90% of the time you can nail it. And another 100% you can get clarity with more labs and other imaging and things. But honestly, that's where telehealth is so powerful. Not only is it reassuring, it meets the parents where they are with their schedule, middle of the night or whatever, but if they can look at on a screen and talk to a doctor, and the doctor can see the child, and you get history and do some physical exam at the same time, visually, it's so high value and it's such an economic, user-friendly manner.
Yeah. Well, so you mentioned 3 telehealth. So Blueberry was the one we just...
Blueberry is one. Then Anytime Pediatrics, they have after-hour pediatric nurses.
Okay.
These 2 pediatric ER nurses started this on their own a few years ago virtually. So we have the pediatric after-hour nurse support. And then there's an entity fresh out of the COVID world from Atlanta. They're virtual child life specialists. It's Hearts Connected. So it's a group of child life specialists. And this is, again, a new novel piece of what we're bringing and bundling.
I've never heard. What did they do?
You probably wouldn't know.
Okay.
Child life specialists tend to live in hospitals.
Okay.
And they help with end of life, ICU, oncology. And they tend to be there as emotional behavioral support for the child and the parent going through these really tough parts of life.
Wow. Okay.
So they're usually been employed. COVID knocked a lot of them out of the hospital, and a group banded together and said we could do this virtually for pediatricians for general primary care issues, because kids have a lot of same needs that might not be hospital based. But imagine death of a pet, death of a grandparent. Starting first day of school, getting a filling at their dentist, having a vaccine, all these things that are big to kids and parents. But these virtual child life specialists can come in as our partner with Hearts Connected and give support in a way that I haven't seen general pediatricians do.
That's amazing.
So we bring board certified pediatricians, pediatric nurses, and child life specialists as our 3 telehealth partners. And then we have some software called Symptom Checker, which is used by a lot of children's hospitals around the country. And as parents, you can on your own quickly put in some symptoms, and it'll spit out likely diagnoses and a likely management. It's not meant to be the end all be all, just another resource that was done, software created by pediatricians.
Very cool.
So those are our 3 telehealth partners, along with the symptom checker software.
Okay, and so that's one leg of the stool, though.
That's one leg.
That's one leg of the stool.
It could be, we could have
that's
our
a
whole
sturdy
business.
leg right there, yeah.
I told them, that's why I tell folks, ParentMD could be just any one of these. But that's what I think makes us unique, is that we bring it all together so parents don't have to go multiple places to get multiple things.
So the next leg of the stool would be education. So education, I know you said you had a couple studios, which I think is amazing, and kudos for you for recognizing the power of what content can do. But what does this education look like? So I'm a young parent. Let's say my wife and I have our first kid. He or she's 2 months old. We just don't quite know what to do. We have questions. So what does this library of content give me as a new parent?
Yeah.
PlanSight is a complete game changer in the world of insurance brokering. As a broker, you know how time-consuming and error-prone the traditional RFP process can be. Well, what if I told you there's a better way? PlanSight is the only end-to-end RFP solution on the market made specifically for benefits agencies. It's like having a superpower that gets you an average of 8 to 10 hours back per employer renewal per year. And the best part? PlanSight supports all carriers, all funding types, and all group sizes for over 20 different benefits. If you're ready to make your RFP process faster, more efficient, and more profitable, it's time to call PlanSight. Visit plansight.com now to book a free demo and discover the future of insurance renewals.
I'll highlight the most recent and first one based on new parents, as you kind of mentioned, as the scenario here. Like we just created something called the Baby Playbook.
Okay.
2 pediatricians who are also moms, I got them together at studio and said, hey, let's create videos about conversations about everything we think parents need to know that first year of life, that we don't think has been done in such a manner by 2 pediatrician moms having a conversation. They work together today. One has older children, one has younger children. So great perspective. So we brought them together, created 50 videos, put on this, and it's called the Baby Playbook. Also put in there what they created was the Baby Survival Guide, which has 71-pager PDFs you can download on all the most common problems first year of life, and it's still growing. And then all kinds of recommendations and resources and everything else that they think you need, checklist, recommendations of these things to buy before the baby comes home. The list is long. Questions asked the first visit to the doctor, things to pack going to the hospital, things to make sure to be ready to take home.
How did you sort? I mean, this is probably a ton of information. How did you source it all?
Hey, when you get pediatricians together who live and breathe this daily, they can spit it out like that.
Okay.
So it was on me to put the team together to hear all that and package it digitally in something called the Baby Playbook.
Okay.
And hence, we wanted this to be our vision for the Baby Playbook, is that it kind of be like when we had kids, everybody would buy the What to Expect When Expecting book.
I remember that book.
And it's still a big book. But we wanted this to be a more modern version with conversations and videos and resources, and one that people would buy, gift to one another, gift for themselves. That's just an example. That was our most recent, because we thought we really need to have a real focus on babies. We do a podcast, so usually have one podcast a month. I think I've done 24 podcasts now.
Okay.
Podcasts with physician leaders, others who are relevant to children's healthcare, things I think parents need to know. So we have a podcast studio dedicated to that. We have cranked out a lot of video courses in the studio where I'll bring in experts from around the country. For example, Ruchi Gupta from Northwestern Chicago, world-leading expert on pediatric food allergies. And we sit and created a lot of 5-10 minute snippets of everything we thought parents need to know about food allergies. Stephanie Eakin in Nashville, who's a triple board psychiatrist. She's a pediatrician, child psychiatrist, adult psychiatrist. And we talked about eating disorders and anxiety and depression.
Amazing.
And the list can go on of people, and there's still more people to bring in. That's probably the funnest part for me, that is endless. The content we can create and the people that want to contribute and bring all this in one place for parents. So it's going to always be growing and adding content. So we do video courses, we do the podcast, create the baby playbook. Next thing I want to do is a teenager playbook. After having,
that one's going to be a long one.
Oh, it will. And I'll tell you, babies, it's challenging, and not to take away how hard it is being that new parent. I mean, that's hard. After you've been there, done that, though, and your kids, you empty nest, you realize some of the most challenging parts, though, were during the teenage and transition adult years. And that's even when everything's great. It's just hard. So I think there's information to be shared and learned from not just pediatricians, but other parents.
Yeah.
So I'm really excited to do that, but I've got a lot more things to crank. We're going to keep going. The baby playbook, with the feedback we've had, that was version 1. Launched a couple months ago. We're getting back in the studio in a few months. I'm going to bring obstetricians to the table, neonatologists, because what I heard from folks, why not get maternal health in here at the same time?
Oh, yeah.
I was like, that's great.
Yeah.
So again, it goes with one of our taglines, Spencer, which is pediatrician-led, parent-guided.
Okay.
So we're not just doing what we think as pediatricians. We're listening to the parents and pivoting on our approach and the content. So we're still learning, and we just want to be that trusted source for parents.
Well, that's amazing. And I'm curious, are you guys releasing any of those like in a bite-sized digestible on like social media platforms? Not to get ahead of the cart on the marketing side of that, I'm curious.
Yeah, we've done pieces and parts, and we've been just trying to stand up the brand, the machine, and crank the content, and really learn before we got too big of a footprint, because and make sure it's all the way we want. We've had great experience with our telehealth. We've, I think, create some great educational pieces. And I think we're just now starting to share and drip some of that out for the world to see and respond to. We have not done that in a big fashion because our team is small and the resource has been small, and trying to learn organically how to approach social media in an effective way.
Yeah.
Which I think I told you, we started on the direct-to-consumer route and found that lift was much more arduous than ever thought. So we've pivoted now. How do we think of bigger populations? Hence our conversation today, working with self-insured employers, brokers, and to understand how can we bring something that's of high value for access and quality of care, but can decrease cost of care because it's better care, and meets employees where they need to be, and which is where employers want you to help them because they're really paying the cost of care, right?
Well, I could not agree more with what you just said. And before we move to that route, because I did want to shift into that, I think you got one more stool we haven't covered, right? We've got
one leg
of the stool.
One stool, three legs.
Excuse me, obviously. So what is the last leg? Because I want to make sure we don't skip over that.
Yeah, I appreciate it. That's the most neophyte component of our world. It's community.
Okay.
And I think community only will grow as we have community, right? But we've tried to connect parents and crowdsource, get their input, feedback, and I would love the platform in the future to have more chat rooms, more connecting, more town halls, do webinars where parents can interface with our folks. So that one is part of the plan, growing up slowly. But I mean, we we've already had some community component to it, but that'll come in time.
Well, I hear there's a lot of people that do like the coaching, right? They're professional coach, and some of them are probably better than others. But I have heard some people talk about the fact that they've created Discord, kind of chat rooms, right? And so a lot of what they discovered is by getting a lot of really smart people in the room that are interested in these subjects, they end up learning, or they end up even getting to pull themselves back from the level of effort they put in, because it's almost like a member-supported community where answers are coming from other peers, which is pretty interesting.
One of the first lessons I learned in private practice was that moms usually knew what was going on, so you better listen to them, and they can help each other more than I could help them, and they were often helping me figure out things. So parents who are living and breathing it, the value of sharing with one another and pediatricians being part of the conversation, I'm really excited where they can go in the future. Obviously, there's a lot already being done in that space. That's not novel for us, but I want to have a bigger presence and community so we can draw and crowdsource and pull things together and have conversations in a way that, again, a lot of this has been led by moms and nurses already, and some pediatricians got in this space and doing it alongside their practice, but no one that I've seen has done it from a physician who's focused on building a business to create these spaces. I'm not distracted by seeing patients. Now, as a result, I'm not as relevant and can't tell you everything that's going on in there. I'm leaning on other pediatricians. I'm leaning on parents to tell me what they want. But taking past experience in a business model to hopefully bring that better, that's the goal.
Well, the fact, though, that community can be created in an environment where, one, it's probably already filled with people that are very interested in the subject because they're participating, they're paying for the platform, et cetera, et cetera. Two, the fact that you connect it to the possibility, I've talked to some other moms, they've experienced this before. This is definitely something I should go to symptom checker. This is definitely something I could engage Blueberry on because it needs to be addressed, right? So there's a connectivity to the other steps in the equation and not just simply a community of people talking. So I think that's why you could differentiate yourself there. So direct-to-consumer model has evolved. You mentioned self-insured employers, which obviously applies well here. But how has it changed, or how does it change to now have a conversation like this with an employer who has 200 employees rather than a one-to-one conversation with a parent? What does that look like? What's that sales process look like, et cetera?
I would say that I'm still learning.
Okay.
Hence, I'm loving the conversation we had earlier.
Fair enough, yeah.
There's a lot to learn from you and others in this space. As a physician who's been at the bedside and been in the corporate setting in academic and private practice, and who's been entrepreneurial in a lot of spaces, the space, though, of working with self-insured employers and the insurance brokers and captives is a whole new space. So, one, I would say that I'm learning. What I'm trying to understand is what do I think I have a good finger on the pulse of what pediatricians and parents want and need. I'm trying to understand what employers want and need for their employees to recruit and retain the best, bring value, enhance care, enhance quality of healthcare, and decrease costs, since we both know the employers are largely the payer of healthcare today, if it's not the government, and we all pay for the government. So trying to understand where they're at, what their needs, and what solutions they have.
What was it about, though, the direct-to-consumer model obviously is labor-intensive. It was the original model and is still a big part of what you do. But what was the recognition that, we probably should expand this out to employers as well?
Yeah. After talking to a few of my friends in Louisville, I came to understand that employers and insurance brokers were looking for creative solutions to bring to populations of employees in a novel way that would truly, not just talk about it, but truly improve quality of care and be differentiated and could impact costs, bend the cost curve. Well, of course, my eyes lit up. I'm like, I think I've got something.
Yeah.
And this isn't just for kids who are just little adults. This is focused children's health care by a pediatrician business person. I get what you're saying. I've owned my own businesses. Yeah, let me come in and listen and help you. So when I started engaging that kind of conversation, I got interest. I heard employers and the brokers saying, that makes sense to me. We've had Teledoc. We've had other telehealth partners. We've tried to do things that help, but we hear from our parents they need help this, and we don't have anything unique from a pediatrician perspective. So it sparked a conversation. I think we can create engagement, and I saw that real quickly. I think I could get traction on more members
Of course,
than going one at a time on direct to consumer, which I'll be honest has been super hard. And I was naive to how hard that lift, increase in education awareness would be of a brand. But with employers, I think I can do it quicker because I can sit there and help them tailor solutions to meet their needs and go in a way that I think they're wanting to go now. I think 10 years ago, this wouldn't have probably been an option, but right now it seems to be a hot topic area for self-insured employers to be looking at such solutions.
Well, I think there's a couple things going on. Obviously, when you get to larger cohorts or larger populations, there's scaled pricing, which makes it more palatable. I think the other thing that's probably going on is employers, most people perceive that their healthcare is delivered through employers nowadays, right? That's sort of the perception of who is the one providing access to my health insurance.
Yeah.
It's my employer.
Who's steering it?
Who's steering
Who's steering the options
Who's steering it, right? And so there's that paternalistic component to the employer-provided healthcare, which I think something like 150 million or 120 million people access their health insurance through employers. And so I think it's a natural offshoot as these employers are looking to do exactly what you said, which is recruit and retain, provide quality solutions and benefits to their employees, but also something tangible that might improve outcomes over time. We were using the term belly buttons earlier, members on a plan. Well, a large percentage of the population is dependents, is children. And so therefore, if you're doing something to address my kids, I feel that's valuable. Thank you, employer. There's also, hey, your kids might cost us a lot of money. Preemie babies are one of the largest claims any self-insured or stop-loss carrier is going to pay. So there's also a financial motivation in order to provide an incentive like this. So I think that's why it's a natural conversation that you're evolving into. And it's just easier. It's deployable. It's easier to deploy at scale as well because I don't perceive your delivery model, the actual system changes that much when it's an employer versus an individual, right?
No, I think pricing just changes. We try to, how can we scale this and bring it to a large volume, a large population. Nicely and digitally, we can do that for all the reasons I appreciate the question. My mind goes a couple of places of why in this space. First of all, it made sense from a business standpoint to scale, I think, easier and be aligned with some others who are aligned with us, as we just noted. The other thing that I think is valuable, given my different roles in healthcare through the years, moms are the decision makers of healthcare. Employers, insurance companies, brokers want to work where they're connected with moms. Well, you can't connect any better with moms than when you're talking about the children's health care.
Absolutely.
And if I can bundle a little bit of that with maternal health care, then I'm taking care of mom and children in a unique way. And then back to this spectrum of care, longevity, continuity of care, continuum, cost of health care. There can be a lot of costs with young kids in spaces of chronic disease or the NICUs you mentioned, but largely kids don't cost a whole lot. But they're a good investment with a good spend. And if you have an employer who's thinking long term and they're thinking about retaining employees for long haul, then you really want to think about costs in healthcare in the long haul, not just right now in the moment,
Absolutely.
Right? Well, let me tell you, we're, in my view, from getting in the corporate world, and as we all know, chronic disease and the older populations are what is the big burden of healthcare in our community, our society today. And a lot of those things, I wrote a paper a few years ago that looked at how to bend the cost curve and improve quality of life in adults in the chronic disease space. I said we need to start back in kids and preventive and healthcare and mental behavioral health in the kids. There's so many vices that adults employ and take on in their life because of gaps in, or what we call ACEs, adverse childhood events, when kids are little. That if we invest in kids when they're little, you're going to get a big cost savings way down too. It's not just an acute. But really the biggest savings, keeping folks from in healthy lifestyles, from becoming obese, from taking on smoking, from taking on activities that are harmful to their health, and take on all these chronic diseases that cost us a lot, whether it's diabetes, hypertension, COPD, the list is long, or averting cancer, which is impacted by a lot of these things too. So there's a lot of benefits. There's some obvious acute short-term, and there's some long-term benefits too.
Well, I'm glad you mentioned that. And so what role does nutritional advice or what that topic in and of itself play inside of ParentMD? Is that a subject that's covered?
Yeah, that's a great question. I would say nutrition has not been a big part of what we've done yet. There are a number of topics that we've tackled, and there are many still to come. I would say, like in the baby space, we have focused on definitely breastfeeding support, bottle feeding, how you pick, and all of that, and the importance. We have a lot of conversations throughout that have to do with reflection of how important nutrition and averting obesity and exercise are. But there is so much more to do on the nutrition piece.
Yeah.
That's one of our future chapters, I would say.
Yeah, I would say one of the biggest issues, right, is like depending on the source of your nutritional advice, you obviously get contradictory advice everywhere you look, right?
Oh,
so
definitely.
it's so hard to parse sometimes. And, that's all obviously weighing in the realm of nutrition. Employers tend to stay out of that area because it's just rife with too much liability and concern. But incredibly important, because when you talk about population health, actual at-scale population health, nutrition's one of the biggest guiding factors of all.
Oh, amen. Between exercise, nutrition, stress management, preventive care, getting in for your checkups, which again, all those require time with a provider, and ParentMD can be an adjunct to help answer questions that you might not have had time with. Another trusted resource to get information. And those are things, honestly, we want to keep listening to the parents and the pediatricians, employers. What do you need? And a conversation we were saying earlier, I could see a day where ParentMD is partnered with employers and helping look at the claims data to understand where the spend is. An example, let's say there's too many ER admissions from asthma uncontrolled. Well, we have an asthma video course by one of the best asthma doctors in the country, and I think ParentMD can be a great partner to come along employers to identify education, support to help people have healthier lives and not go to the ER and not do things that are an unneeded
Well, it's
spend.
specific to that employer's unique population, and it could drive behavioral change as a result because you targeted the information to them.
Based on the data.
Yeah.
So if we can be targeted in our approach based on claims data and working as a partnership. So what I'm really getting at is I think it'd be exciting to have true partnerships. Everybody working together, but letting data drive it. Now, the thing for me as a pediatrician, I know if this employer is having this problem over here, everybody else is too. But we can be more targeted as needed and tailored as we see the need.
Well, and so before we land the plane and go into the kind of the big picture of healthcare, because you've been a practicing physician inside of our healthcare system, so I'm sure your perspective will be very, very insightful here. You've got a model that has a couple different tiers, that has certain engagement levels that allow certain access. So if maybe you want to broadly describe those, but then even my question beyond that is the membership model in of itself. Kind of talk about the concept behind that and why you think that's the best way to deploy it.
Yeah, I know that's a great question. My mind goes into so many different tangents. I'll try to focus this way.
I just so you know, I ask complicated.
Are you okay with tangents?
Yeah, I love it. I ask hard questions sometimes, but
for me, I've seen healthcare delivered in so many different models since I started in private practice. And when you're in training in med school, you're not taught all these. Today they are a lot more.
Okay.
But I never saw concierge, direct primary care, membership, telehealth. Those were words not used when I was in medical school.
Yep.
Today it's totally different. Oh, and now healthcare has become so disrupted because we've gone from paper charge to electronic charge. Now we transfer of data. Now you have employers really who are on the hook with being self-insured and not just working with TPAs in the normal fashion. Now they're like, I'm at full risk. Oh, and everybody's talking about how do we transition from volume to value? How are we population health minded? All of these have created, I would say, a chaotic, complex environment. I think healthcare is the most complicated industry out there, but it's also ripe for innovation. We all know healthcare is way behind in being innovative compared to aviation and other areas. And, we should be the most highly reliable industry out there when you talk about high reliability. Aviation, though, is about the top. Healthcare is down the list, but we want high quality, and to have that, you got to be a highly reliable organization. All that to be said, there's a lot of different models, a lot of different ways to execute and deliver the models. Hence, when we come talking about memberships, to me, it makes so much sense because it's like, all right, who can, from a business standpoint, go out and source resources, telehealth partners, education. Me having my own studios, like you're in this studio, and me knowing who the best telehealth partners and bundling in value based on volume and work and being aligned to take care of families together, we can bring value at a lower cost to people in a more effective, efficient manner than the days when I was in private practice and you're calling to make an appointment and not getting in when you want and waiting 2 hours and then being there for 10 minutes. Doctors frustrated. Oh, and 60% of doctors are burnt out today. That's a whole other conversation the other day in a meeting I just came from. So physicians are burnt out. We got antiquated healthcare delivery models. A lot of it's still based on a physical presence of coming to a spot. But with ParentMD, we get to disrupt some of that with telehealth, information, vetting it, bring it in one spot, membership, and me being a physician business person, identifying experts, and then being able to broker resources at a more cost-effective manner to bring it in one price. And whatever I was telling everybody, for $1 a day, no matter how big your family is, for the family, you get unlimited access to everything I just talked about. And everybody often looks and says, well, how can you do that? Well, one, we're starting with lower prices early to get critical mass for a new company. But we can do it and still be profitable because I brought everything together in an efficient manner in a way that you can do healthcare today that wasn't done years ago.
Right.
And leveraging, relationships in the digital space.
Well, I think even too, just the fact that it is a membership model sort of suggests that it's going to continue to evolve, right? You're constantly building out these libraries,
more
right?
Content,
so it'll always stay relevant. Yeah, more value.
More value, and hopefully adding different ways to interface with the consumer in a way that I don't even foresee today. But the platform and the brand is there to build upon.
Yeah, absolutely. Well, I mean, honestly, I love what you're doing. When Scott mentioned this over a cocktail at U-Powered Symposium, I certainly leaned in and was intrigued, and I'm glad we got all the way to this point. So anything else we want to cover on ParentMD before we move to kind of healthcare in the future? I'll make sure we leave the space.
Yeah, I appreciate the question. I would summarize by saying the desire is that ParentMD is that trusted brand that parents will think of in the future. That's their one-stop partner, knowing it's led by pediatricians, guided by parents. And right now, we're just in the beginning of this journey. We're offering a lot. There's more to come.
Yeah, awesome. And I love that. So I do want to get your unique perspective on our healthcare system, right? I think this can go a number of different ways, but I'm always curious to ask nearly everybody that sits on this couch, what do you think the future of healthcare looks like? Obviously, you're betting on a certain aspect of the future of healthcare to look like what ParentMD is doing.
Right.
But broadly speaking, the United States, our healthcare system as it is today, where are we going?
ClaimDoc is a medical claim auditing and member advocacy company. We provide fiduciary services to employer-sponsored benefit plans and allowing them to create an environment where we ensure that the benefit plans are being charged on a fair and reasonable basis.
My business is basically people, and it become a real simple transition. We thought it was going to be far more complex. I've saved, we'll say, hundreds of thousands of dollars. I could not say enough about ClaimDoc.
Well, we know, let me set a little bit of landscape. We know that 20% of the GDP is healthcare.
Is it up to 20? Wow.
It's 20%. I remember when it was 15%, 20%. So we've got that. We're in a very disruptive phase in the last 15, 20 years with EHR, role of payers, employers, patients accessing their own care. COVID totally disrupted it, made telehealth more apparent, made patients decided, I need a COVID test. Didn't have to go get approval from the doctor. They just got it, right?
Yep.
So patients started interfacing. Retail care has become even more. Now you're getting care at CVS and Walgreens in a way you never would have before. Patients are ordering their own medicines and then the biggest conversation, I was at Nashville Healthcare Sessions last week and just came from Colorado Springs in a board meeting. And what was the topic there? AI.
Yep.
So AI has been around for quite a while into clinical decision making. It's now coming into how we can help the populations make better decisions and insert AI in a way that we haven't thought about. So everybody acts like it's new. It's not totally new, but it's going to be embraced more in the future. So technology is coming. Again, I'm going to go back to what I said earlier. Healthcare is still very antiquated from operations, processes, technology, the digital space. So we've got a lot of learning to do from other industries. I think you're going to see the next few years be very exciting and start pulling a lot of people together in ways that they were not aligned. They've always been aligned, but they weren't working together well. I think you're going to see technology coming there. I think patients and consumers are going to be more and more empowered by the internet. I think they're going to take control of more. I think we as healthcare providers are going to have to come along and be more consumer-centric. We're going to have to be really mindful of our partners out there who are paying the bill for healthcare, and that's the employers. I'm really excited about the space, and that's why I was so excited to come have this conversation with you. So I think employers are going to have they can't just sit here and keep being told, and premiums are going up 7-8% a year on average, right? JP Barrett was telling me that last week with Legacy. And, the average is 7-8%. Yeah, that's unsustainable. And that's why everybody's excited. If you can just flatten that curve and not have an increase, we actually needed to go back because we can't keep spending like this. And we can't keep getting the results that we're getting for the country, the United States, compared to other countries in the world when our mortality, morbidity, and our healthcare outcomes are not matching the spend. So that disconnect cannot continue. The other trends you're going to continue seeing is physicians being employed more and more. Now, some are leaving some of the corporate and breaking back out some of the subspecialists and having their own ambulatory surgery centers, a lot of specialists. But primary care, for the most part, is going to keep being employed by large conglomerates. You're also going to see another trend, which we were talking about just a little bit earlier, is concierge and direct primary care.
100% agree.
I think employers are going to embrace it, look at that more. Pediatricians are the last bastion probably in that, but the adult primary care is really jumping in that space of saying, hey, for a certain fee the consumer can pay or the employer could pay and have a physician who's protected, they got a limited panel, 300, 400, 500, 600 patients, whatever it is, and now you've got guaranteed access, more access, physician less stressed, less burned out, and patients are going to now get what they've wanted and longed for so long and hasn't been delivered in the current model. So I think the model is going through a major paradigm shift. And one more statement I'll make, and then as I know you want other pieces, there's a paper I wrote a few years ago looking at an observation of S-curves in physics. And there's an old pediatrician back in the 1980s who wrote a paper talking about the first S-curve was the sick curve. So the 1900s were always about trying to help people who were sick, and so anesthesia came along, antibiotics. That was our whole focus in healthcare. Well, once we tackle that, then you come into the 2000s. It's about trying to make people well. So then chronic disease, preventive care become a thing. He highlighted in his paper that where these two S-curves transitioned, which was about the early 2000s, and this was in the 1980s he wrote this paper, there'd be a massive chaos. But once we got past that chaos, which I think we're getting out, and that's what I wrote a second paper on, we're going to start having this great uptick and great advancements in healthcare because we're going to really start making people healthier for lesser costs and doing it better. So I think the rest of the next 40, 50 years will be this crazy place. And then I wrote a next paper and called it the longevity curve paper, and said there'd be a third S-curve, and it's all about helping people live longer. So we first focus on sickness. The world we're coming out of now is really how do we get everybody well, better, and use our resources. Once we conquer that, in a few decades from now, we're just going to be focused, how do we get everybody to live longer? But we're right now in a very chaotic period, and I think we're coming out of that.
Well, man, there's so much. That's probably one of the best answers I've had to that question just first. Let me say that too. So thank you for that.
I know it's the right answer.
You got me really jazzed and really excited about what you're talking about. I think where we are in that S-curve when you're talking about longevity, what I really believe is we're talking about optimizing human health and optimizing, because we've got hundreds of years of history of nutrition, human performance, healthcare. Now I think we're breaking free of maybe perhaps some of the political and or financial headwinds that have sort of constrained the conversations we've had or directed kind of population at scale. I think you're seeing with the fragmentation of influencer type folks and people willing to sort of break the mold, that information seeping out and all over the place and people are able to access it. So to me, your conversation about longevity also comes to human optimization and really getting to the core truth of how humans thrive. I think that's the bastion we're about to cross. And that's what gets me jazzed. You can tell I'm excited right now because that's the stuff that I love. And that's where I think you go back to, you've seen those videos from the 1960s where people are walking around and everybody's fit and healthy and nobody's overweight. My hope is it may take us another 20, 30 years to get there, but we might return to that level.
Well, I hope so, because that's we're talking about how we're about to figure it out and where we could go and we should be going based on all we've learned. But if you just walk out in our society and go to any store, any place, you see that we are like in a place really of crisis.
Yes.
Just looking at inactivity and all the problems that we're talking about, and then you see it in our body habitus and how people are living, eating, and everything else. But I do think there's hope, and I do think education is key. I think telehealth will be a resource. I think all these things will help us get to, I love how you put it, optimizing health. And I think we're in that place where so many people want to optimize. We just got to get everybody aligned on the resources and quit wasting resources, quit burning our doctors, and get our patients what they want, which is time and information in a way that actually helps us maybe bend some of these curves.
Well, and trusted too. I think you use that term. Trusted is key, right? And I think people have a general kind of distrust or mistrust in some of the healthcare system, right, nowadays. And so they're looking to find their own information and their own sources, which they believe are correct, right? Which also opens itself up to the other side, right? And so what I'm hoping is that you've got kind of this bifurcation that will come back to the middle, and there will be, quote unquote, truth that is accessible to the masses. And so that's kind of my more diatribe level focus, but I appreciate you bringing that up. And again, I think that was a fantastic way to end this podcast. So closing thoughts, Josh. We've talked for an hour or so, a couple minutes, whatever you want to say. The floor is yours, man.
Yeah, I appreciate it. One, thanks for having me. That was a fun conversation. It's amazing how an hour can go by so quickly. In closing, I would say that this conversation reflects why I went into what I'm doing now. It's exciting. The opportunities are endless. There's a lot that needs to be done. Children's healthcare is different than adult healthcare, and I think trust and truth is so key. Hence, trust is our first value of our company at ParentMD. We just want to be here as a partner to pediatricians and parents to serve them in a way that they need, that's relevant, and helps them move forward in the future to raise healthy children and enjoy the experience of parenting. I think there's so much to be done, but this is what fills my cup. Yeah. I like to grow things. I like to build things. I like to do things different, and I want to come along this journey, and I'm going to end by saying, that's why it's so excited to come here and have this conversation, because I never thought when I started this that a lot of it might be with employers, self-insured employers and insurance brokers. That wasn't the space I thought I was going. I think it's a space that is ripe of opportunity, and we can bring value. So to me, that's fun, exciting, just to do things differently. So, well,
nearly 2/3 of the employees in the United States are in a self-insured health plan. So that gives you an idea of the total addressable market through there. And I mean, I love it. Obviously, I'm passionate about this space for a number of different reasons. But I appreciate you coming on. And obviously, this may be one of many conversations we have. But it's great to get to know you, Josh. And again, thanks for the effort to get down here.
Yeah, thanks for having me.
My pleasure.